Amazing. Okay, let's go ahead and get started. I want to leave plenty of time for our presenters because I feel like we will have a ton of questions on this topic. So, hi everyone, thank you so much for joining. I'm Nicole, Good Dogs Community Lead, and today we have what I think is a very exciting presentation. We've never covered a topic like this before at Good Dog, and it's getting a jump start on good oral health in puppies with our guests, Dr. Christopher Smithson and Dr. Emily Duca. In today's presentation, we're going to learn about how to understand normal oral anatomy and how you can, by understanding that, detect common abnormalities to look for when you're evaluating the oral health of your puppies. So Dr. Smithson and Duca will explain malocclusions, missing teeth, periodontal teeth, along with some recommendations for breeders to share with new puppy owners on when to seek veterinary care and treatment. So I find puppy teeth very interesting. I think canine teeth in general are a really interesting topic. And I feel like it's really hard to know what the right answers are and where to get that information. So I'm very excited to have the two of them here today for everyone to ask questions and they can share their wealth of knowledge. We're very excited, as always, to partner with Purina for this webinar. This was a topic, like I mentioned, that we've never covered before, but it's been requested by so many of you. We see questions come in all the time about caring for puppy teeth into adulthood. So we're really excited to have this webinar today and thank Purina again for helping us bring this to life. As always, we got some previously submitted questions, so we're going to prioritize those at the end during the Q&A section of the presentation. But of course, feel free to ask away throughout the entire presentation, and we will do our best to answer the ones that come in live as well. And before I kick things off and pass it over to our amazing presenters, I just want to share a little bit more about Good Dog for anyone who is new here and joining us for the first time. Good Dog is on a mission to build a better world for our dogs and the people who love them by advocating for dog breeders, educating the public, and promoting canine health and responsible dog ownership. We're a secure online community that is created just for responsible dog breeders like yourselves to connect with serious good dog applicants from all across the country to find perfect homes for your puppies. We help breeders run all aspects of their breeding programs from start to finish, from getting your litter of puppies listed, connecting with good dog buyers, to getting payments for those puppies securely, and all of those smaller things that happen in between. Good Dog is really here to help breeders run all aspects of their programs from start to finish, so you can spend time doing what you do best, which is raising happy, healthy puppies, and let us help with some of the rest of that. We also offer a number of free educational resources just like this. We have webinars every single month. We also have a really great library of past recorded webinars and our podcast. So hopefully if you visit our website at the link that we'll drop in the chat, you will find there's something for everybody. But if there's ever a topic that you find that we haven't covered, please let us know because it really helps us bring future webinars and podcasts to life. So we have that for everyone. We also have health-related discounts, which I know is everyone's favorite topic. So hopefully all of this sounds interesting to you. If you're not yet part of our community, we would absolutely love to have you join us, and you can apply anytime or just learn more about our mission at gooddog.com/join, which we will also drop in the chat for anyone who needs that. And I think that is it for me, so I will pass things off to the two of you to get our presentation started.
All right, so I think hopefully everybody can see and hear us. I'm Dr. Smithson, veterinary dentist. This is Dr. Duca. She's our superstar resident here at our specialty dental practice. And so we're in Florida in the Tampa Bay area. And I think we're kind of excited to do this. It's a little bit different for us than the presentations and kind of lecturing and teaching that we kind of normally do. But I think this is a really good opportunity for us and y'all to be able to kind of have some conversations that I think will really help the pet owning population. I think what we find that we do in our practice a lot is a lot of providing information to referring veterinarians when they call because they've seen problems. And then in our practice every day, we're providing information to pet owners, some new, some experienced, but lots of giving information. And in some cases, in many cases, we may be giving them information that's very new to them. And so I think that this provides a little bit of a unique opportunity for us and for y'all, because because y'all are seeing people the very, very front end of somebody getting a new pet. Everyone's excited, and I think y'all have an opportunity to provide some of that initial education to those people and kind of create a nice baseline for them to move forward. And then that gets reinforced by their regular and routine visits to their family veterinarian. And then hopefully, if they ever end up having to come see us, then they've already kind of got some of that information provided to them ahead of time. So in that vein, we'll kind of go through the things that we have thought were pretty important or that would be relevant for us to talk about. And so we will kind of go through some of the kind of more common oral things that you may be able to identify, some of the congenital or heritable things that we may see. We'll talk a little bit about periodontal disease, and we'll talk about some, especially dental home care and preventing dental disease, not just periodontal disease, but also the more, the common things that we see, like fractured teeth. And so we'll go through some products and recommendations, I think, that y'all can make for that. So I think we'll kind of bounce back and forth a little bit on what we're going to provide or kind of who's going to do the talking. And then either one of us whoever's not doing that may provide a little color along the way to provide some additional information. So we'll kind of talk about some kind of the basic stuff. You want to go into the
yeah. So I kind of wanted to just start a little bit from the beginning as far as like teeth eruption goes. I don't want to get too far in the weeds with it, but I do think part of it is important for breeders and young dog owners to understand when these teeth kind of erupt and the timing that we would expect to see baby teeth versus adult teeth. So I have a fancy slide here for you that says that about 0 to 3 weeks that puppies aren't born with any teeth. So you'll, if you ever do look inside a very young puppy's mouth, there will not be any teeth in there until about that 3 to 4 week mark. And then we're starting to get those incisor teeth, or those teeth in the very front of the mouth, the little ones on the top and the bottom. And about 3 to 4 weeks, we also see those big fang teeth, or those big canine teeth that are kind of right behind there. And then around 4 to 12 weeks, we're looking at teeth starting to erupt a bit farther back in the mouth. And these are our premolars and molars. Puppies don't have any molars that are deciduous or baby teeth. But when we talk about further eruption into our permanent dentition, we're saying at about 3 to 5 months, we're seeing those incisor teeth in the very front of the mouth, the baby teeth, being replaced with those permanent or adult teeth. And then about 4 to 6 months, we're seeing the permanent canine teeth, or those big fang teeth, starting to come through the gum line. And, during this time, you might need to provide some extra chewing and things, because they do tend to want to chew and, the teething process. About 5 to 7 months after that, you're going to see that permanent teeth are erupting a little bit farther in the back of the mouth. So then we're talking about premolars and molars. Overall, I think we like to see that dogs have their full sets of teeth around that 6-month mark, although there's some variability, especially in our younger or our smaller breed dogs. You have anything to add?
Yeah, I think she mentioned that there are no deciduous molar teeth, but if you go back one slide, that circle that you have there, you can kind of see that those teeth that are circled in there, this lower bigger tooth is shaped very much like the adult or permanent mandibular first molar, which you can see there. So it does take on that crown shape. It's called molarization, but those are in fact just premolars. And then the same is true for that maxillary fourth premolar. It will look like a maxillary first molar, and that maxillary premolar that's in that view there, a deciduous tooth, is technically a maxillary third premolar. Just so if you're kind of talking to people, that's what it is. So there's a smaller number of deciduous teeth than there are permanent teeth. I do think it's important to know which teeth you would expect to see erupt in a puppy, because even in a puppy, if we have missing deciduous teeth, that could be important, or if they're not erupting on time. So that's why we wanted to go through the timeline. Go ahead.
So how do we really know if something's wrong? Well, knowing which teeth should be where is pretty important. That way, if they aren't there, that you can recognize that something's going on. On the screen here, you'll see this is a younger dog who came into us, and it was missing this first lower premolar on the bottom. And then once we got the dog under anesthesia, did some x-rays, we see that that premolar is kind of laying down and covered with just a little bit of bone. So it can't really get up and erupt properly. Really important to try to diagnose these and find these, because it can lead to a cyst formation in this area. Pretty commonly, we see this in our brachycephalic or smushy face little French bulldogs, boxers, pit bulls, other brachycephalic breeds. And so if we recognize early that this tooth is missing and go ahead and treat it with extraction, we can, kind of ward off that risk of having a cyst form in this area. We have seen some cyst form here that, gone untreated, can start to push up on the bone that actually supports other teeth. And so not only are we then losing the tooth that's not erupted, but we might be losing that big canine tooth, which is a strategic tooth.
Yeah, and I think we recognize that for the timeline that these puppies are with y'all, some of this may be happening after, but I do think that the value that you can probably provide to people is to kind of let them know what they should be looking for and what the time frame is. And very often these first premolars, they also don't have a deciduous tooth counterpart, for what it's worth. And so that tooth is usually erupting at about the time that those permanent incisors are first starting to erupt. So that's when you should be seeing those. And that may be happening still somewhere around 4 months of age. But again, it's something to just kind of let people know that they can be looking for at home.
And then again, I just kind of put this back up here for reference, just so we understand when teeth should come in. And this is the permanent teeth. So again, like Dr. Smithson was saying, that you guys might not have these guys until 4, 6, 7, 9 months. They might already be in a new home. But here's kind of what you're going to be looking for. I also do want to kind of say that, puppies are going to the veterinarian every month or so to get vaccinations. And I think developing a relationship with a primary care veterinarian to keep track of eruption and making sure everything is coming and going as it should is pretty important. And they're always at the vet. So what a better time.
Yeah, and again, I think when you're preparing people for what to look for, the question always comes up to us a lot of times. It's like, well, how long is it okay for that deciduous tooth, that baby tooth, to still be there when the permanent tooth is coming in? And really what people should be seeing is that deciduous tooth gets loose because the root gets resorbed and it falls out as the permanent tooth is erupting. And that's what should be happening. So I think it's safe for y'all to tell people ahead of time and kind of educate them that if they ever see the permanent tooth and the baby tooth both in the mouth trying to occupy the same spot at the same time, that's abnormal. That runs the risk of developing some problems with the teeth and inside the mouth. And that is when that should be addressed. It's never really supposed to happen with those two teeth being there at the same time. And like in the pictures that you can see here, oftentimes, and what's supposed to happen is that permanent canine tooth on the top, it'll erupt on the nose side of the deciduous canine tooth, which can cause some malocclusion problems. Obviously, there's crowding between those teeth in an abnormal way that predisposes to periodontal disease. And then on the mandible, the permanent canine tooth tends to erupt on the tongue side of the deciduous tooth, which also can cause some problems with occlusion.
I think also we're saying that when these two teeth are sitting as close as they are, even from these pictures, you can appreciate that there's kind of some plaque and calculus buildup in between the two teeth. Obviously that big canine tooth is a really important tooth in the mouth, and the last thing we want is to have some bone loss up the backside of that tooth from that baby tooth being left in place, and that calculus buildup in that area. So really important there. And I think that sometimes, as in this dog, we have some issues with traumatic occlusion, especially in this region where likely this tooth, because it never actually erupted, fully fell out, caused this tooth to erupt in an abnormal area that then caused the tooth to then occlude with the incisor on the bottom, pushing that out. So it can quickly be like this domino effect. And I think our best recommendation in this case, and this is a case that we just saw, is that you would go into your veterinarian and hopefully they can provide extraction as a treatment for these deciduous teeth that are causing an issue.
Yep.
So let's talk a little bit about malocclusions as well. I'm going to kind of run through like technical terms just real quick about malocclusions. Don't expect anyone to remember this, but it does help to kind of talk about, what we want to do and what we want to look for. So ideally, we're looking for this occlusion right here in the picture. We're saying that the lower canine teeth are occluding between that last incisor on the top and that big canine tooth on the top. And then we're also looking along the side of the mouth, and we're seeing that the upper premolar is falling between the lower premolars and kind of that V-shaped. And we're also looking at the developmental groove of the big carnasial teeth that should be in line as well. And that's shown right here with the arrows, seeing that little kind of crevice in the tooth there. We really want those to kind of fall together and show that those two jaws are the same length. And so when we talk about a malocclusion 1, we're really just talking about jaws that are the same length, but we have a tooth that's moved out into a different location, as in this lower incisor tooth. Malocclusion 2, I feel like this is probably one of the most often that we see, because this a lot of times requires some sort of treatment, but this is really just saying that that lower jaw is a shorter length than the upper jaw, which when you shorten that jaw, then you're pulling all of the teeth back. And because dogs have these big spiky canine teeth on the bottom, then they start to hit tissues they should not hit. And then we also have a class 3 malocclusion. This is kind of a breed standard for our boxers, French bulldogs, our Shih Tzus, but you're seeing that that lower jaw is longer than the upper jaw, and the incisors are sitting kind of out toward the lips. And this can also sometimes cause some problems and sometimes cause some rubbing of the teeth and wearing of the teeth in. So may need some treatment at some point too.
Yeah, so you can go to the next slide there. And I think this is when we get involved, right, in trying to help sort out when it matters. Because I think from our standpoint, when we're thinking about patient care for patients that have an abnormal occlusion in some way, whether it's one tooth or whether there's an abnormal jaw length relationship, kind of what we describe to owners and what we describe to veterinarians is that our two main concerns is comfort and function. We understand that there are, in some cases, for animals that are intended to be shown, that there may be a need to kind of adhere to a little bit more of a kind of a strict standard or something that's closer to what somebody might call perfect or ideal. But from our standpoint, for what's relevant and important for the patient, it really boils down to two things, and that is comfort and function. And so if they can use their mouth and their teeth to do all of the normal things that they would need to do, and they can do that pain-free, then that's a really, really good outcome for most patients that we would see, certainly. And I think the reality is for most dogs that end up in homes where the expectation is, and the hope is, that they're a really, really good family pet. And so she said that the class 2 is the most common malocclusion that we see. It may very well be, but I think it's probably more so the one that we see that causes the most problems. The class 3, because it is expected to be that way for a number of breeds, may be the one we see the most, but oftentimes it's probably the one that we do the least amount of work or make recommendations for. So it is true that you can have tooth wear and attrition or wearing of the teeth over time by tooth-to-tooth contact can be a risk factor for some problems. And when it's severe enough, it may be something that we recommend treating, but it isn't always. And for those breeds where we expect that that's what they should look like, we accept that some tooth wear over time may be something that we see. And there may not need to be any other recommendations for that. For class 1 malocclusions, where there's a tooth that may be in an abnormal position, there's a number of reasons why that might happen. And they don't all have to do with heritability or anything like that. So if a deciduous tooth just happens to hang on longer, we already said in some cases that may force a permanent tooth to come in an abnormal location in the mouth. Any sort of or some sort of like minor trauma that could occur to a tooth when a patient is very young might cause a tooth to erupt in a little bit of an abnormal position. And so again, with that, the recommendation is usually to treat that with the goal being comfort and function. And treatment options will vary. But I think it's those class 2 malocclusions where oftentimes it ends up resulting in a traumatic occlusion where you have especially lower canine teeth that may be hitting the roof of the mouth. We've seen some of those, and I think we have some pictures here we'll show you of ones that are really problematic and often do require some treatment to achieve those 2 goals. We know we're never going to make that occlusion perfect, and we don't need to. So we have to gear our treatment towards our 2 main goals. And also some of it does fall to, kind of what the owner's desires and goals are for the patient when it comes to whether we have options to try to save teeth or not. But I think that when we see class 2 and class 3 class 2 malocclusions, for sure, where the lower jaw is shorter, and then class 3 malocclusions where it's not considered to be normal for the breed, in our experience and kind of the experience of our colleagues in veterinary dentistry in general, we do believe that those types of malocclusions are heritable. And generally our recommendation for breeders, and we've had these conversations with breeders on an individual basis. Sometimes we've had it with owners and they've had conversations. And I think when everyone is looking at this from what's the best thing for what we're doing, what y'all are doing, what's the best thing for the patients, and we're really doing things in a responsible way, our recommendation would typically be that that affected individual should not be bred, and the breeding pair that produced the litter from which that affected individual came probably shouldn't be repeated, because one of those individuals involved that created that litter is carrying this, we believe. Now, these genetic studies are probably never going to get done in dogs in any sort of way to confirm this for severity and types of malocclusions, but we do know that this is something that tends to pop up again from affected individuals and from breeding pairs that produce affected individuals. And so that would kind of typically be our recommendation, certainly as it relates to this audience.
So I did just want to include kind of a newer, more up-to-date study that and the be-all end-all is talking about malocclusions, and I want this to kind of bring attention that some of our poodle bred crosses were kind of a bigger part of that, and I think that kind of translates to what we see in practice as well. It seems to be commonly that we do get these poodly doodly breeds, and they also kind of named Labrador retrievers as well. So I just wanted to bring that up, that people are noticing this and documenting it, and we're seeing them and we're treating them.
So there's, I think this may be the image from earlier, but that kind of shows what we would call a class 2 malocclusion. You might see it referred to as mandibular distocclusion, just meaning that the lower jaw is located further distally towards the back of the head than it should be. And so the result of that is those lower canine teeth are traumatizing the roof of the mouth if left untreated. Do you have another slide next there?
Yeah.
If that's left untreated, then that can cause some pretty significant damage to the tissues in the roof of the mouth. It can cause damage to the maxillary, the upper permanent canine teeth, if it's causing a hole along the side of that tooth. But we have also seen those end up resulting in a communication between the mouth and the nose that results in nasal discharge, chronic sneezing, upper airway issues. And those, the longer they exist, the more difficult they tend to be to address. So those are the important ones that we want to treat. And then if it's possible for those to be prevented, I think that that is sort of the part of the process that I think y'all are able to help affect some change. And for what it's worth, I think we've seen certain breed populations and breeders involved with those breeds be able to affect changes over time. And the one that I think of that seems pretty obvious is with Shelties and what are commonly termed lance canines, where the upper canine teeth are they erupt pointing forward like a spear. It's very difficult to know because the baby teeth oftentimes look normal. They're in a normal position, but in that breed in particular, affected individuals would have normal baby teeth, and then when the permanent teeth would come in, the upper canine teeth would point forward. And I'm bringing this one up because there was a concerted effort for many years, and still is, as far as I'm aware, to try to avoid seeing that. And I think that we see far less. I've been doing dentistry only for 15 years and been a veterinarian for coming up on 25 years. And I think I see way less of that than we used to. So it does take time. It takes awareness. And I think that is certainly a beneficial change that you guys can see the effects of over time. And I think people appreciate it when all of us are kind of campaigning and championing for eliminating problems when they are preventable.
All right, so I did include a case that we just treated a couple of months ago, and I kind of wanted to go through it to also bring awareness to what happens if we don't do anything with these malocclusions. So this dog was a 2-year-old neutered male golden retriever. He'd just been adopted by the owner. They came in and were told by the RDVM, who did a great job in saying that, hey, he has this malocclusion. You've seen this picture a couple of times, but I really just wanted to show that this is 2 years of having that lower canine tooth kind of traumatically occlude the inside of that upper canine tooth. And so the second picture on the upper right there is just showing a probe in the area. You can also kind of see on the canine on the other side, this kind of semi-lunar circle, and that's where both the canine teeth were every time the dog closed its mouth, hitting and occluding up there. It had caused enough of an issue in the upper canines that it had a draining tract and it had an abscess up around the roots. I included the x-ray there too, just to see that kind of halo around the root of the tooth. If anyone's ever had an abscess tooth, it can be very painful. So this dog was living with this for quite some time. We got him under anesthesia and we ended up having to extract those abscessed upper teeth, which was great because it kind of made some room for us to move those bottom teeth out. We put a device on this dog called a crown extension, and it was literally just a buildup of composite material that kind of acted as a guide in pulling that tooth out every time the dog naturally closed its mouth. So it's a really nice way that is kind of non-invasive to help treat these He did really well. He came back for a recheck. The last picture there after treatment, he was really happy, and we were pleased with this case. Turned out very well.
This is one, I think we just have the one slide here for this, and I know that most of you are going to be aware of cleft palates. This is just one of those things that I think oftentimes y'all are going to be the first ones to know this. Hopefully you are taking a look at them. When it's a primary cleft palate, it's a little more obvious. The secondary cleft palate, maybe a little less so, unless you're seeing them having problems nursing. I think that if these affected dogs are still with y'all, obviously we're happy to take a phone call or review an image and have a conversation about maybe what can be done during the time period where they're still with you. I think when some of these dogs can be fixed, others may not be able to be fixed, and then still others may not really need to be fixed depending on how they're affected. And so I just think that obviously letting people know if a dog is leaving you and going to a new owner in a new home, then having people that are aware of this, we may be able to provide you and that family with some information up front about whether it can be fixed or whether it should be fixed. I think that this would be another situation, I think, where if this is popping up, we may just have to look at breeding pair combinations to possibly try to avoid this in the future. But these oftentimes we don't fix them right away. So if most of these dogs are leaving you at about 8 weeks of age and going to a new home, that would be a little bit early for when these procedures would normally get done. And so I just think having kind of open and honest conversations between you and the new family and their veterinarian or us or someone like us on what the expectations are and what may or may not be realistic for them. Normally we will fix these when they're a little bit older, like somewhere around 4 to 6 months of age. And very often there's some nursing care involved for a lot of these until we can get them to that point where there's enough skeletal development that we feel like it's an appropriate time to go ahead and fix them. Did you have anything else you want to say about that?
I think so. That's good. Thank you. Just some important things I think to, pass along to new puppy owners, especially based on how green they are, if this is their first puppy or their 15th. Signs of oral pain can be sometimes subtle, but dropping food a little bit or poor weight gain. With some of the cleft palates and things like that, we might see some nasal discharge from stuff getting up in there. Painful when they're trying to open the mouth or pet the head or anything. And then if you're noticing the inability to fully close the mouth or pawing at the face, blood tinged saliva, I'll probably use that a little bit carefully because sometimes puppies, as they're teething, are going to have a little bit of blood tinged saliva. So that's not always a glaring red flag, but if it's happening all the time or it seems excessive, then I think it's worth a trip in. And again, most of these pet owners are going to be going every month to get vaccines anyway. Just have your vet look in the mouth. So we're also going to do a little overview of periodontal disease, and I've included some slides with probably a little too much information, but I think what I really wanted everybody to get out of this is that periodontal disease is something that kind of happens over time. It is progressive, and there's ways to kind of intervene to help slow that down. It's really just defined as chronic inflammation, and all of our gum tissue and bone that sit around the teeth and hold the teeth in place. Whenever there's a lot of microbial proliferation, bacteria, plaque forms, biofilms, all the things happen, and the body has a response to that. And so inflammation then angers the nearby bone and tissue, and you get recession of that gum tissue and of that bone. Eventually, as you can kind of see on this x-ray and the tooth on the left, the whole root is exposed, and that's kind of an end stage periodontal disease where the body is trying to push it out and it would eventually fall out. So there's a couple different stages. So we're really talking about stage 0 here, meaning that I'm put this on here to show nice healthy teeth. So we on a daily basis are looking at that gum attachment and that bone attachment, and we want to see that everything looks pretty perfect if we're going to call it a stage 0. And then we're talking about stage 1, where we're really just looking at gingivitis, a little bit of reddening around the gums, a little bit of calculus and tartar formation, but that bone that actually supports the tooth is still very, very healthy and happy.
In stage 1, just in its most basic description, is just gingivitis only, and it is the only reversible stage of periodontal disease. This is a point where if we don't have bone loss and we don't have attachment loss, intervention really does help quite a lot.
Yeah, so again, we'll go over home care things that you can do, and then things you can do with your vet as well as far as cleaning.
I think for me, like with my own dog, that's really what I start to look for. I know that we're doing what we do at home for home care, and we'll talk about all of the things that can be done. But when I start to see her have a little gingivitis, that's really when I go, okay, we're getting a little bit behind with what we're doing at home. And now's a time when I think we have the greatest chance of going in, doing a professional cleaning and kind of reversing that back to a healthy state with the periodontal tissues.
Right. So stage 2, now we're actually talking about a point that we can't really come back from. Stage 2, although it's still very mild, we're talking about a little bit of attachment loss. We've had enough inflammation from calculus or tartar on the teeth that now we have the bone and the gingiva and the attachment kind of start to recede, but it's still a small amount. Not all is lost here. I would definitely still recommend, cleaning and seeing your veterinarian for an anesthetized cleaning at this stage. And then stage 3, this x-ray is just showing a pretty big pocket on the back of that big molar tooth, but we're talking about quite a bit of a moderate amount of bone loss or attachment loss here. In our practice and what we do and the training that we've had, sometimes we can treat these with, fancy procedures, but you're really kind of getting to the borderline on this one as far as if that tooth can remain healthy. In people, if we had this defect, it would be, we would go home and they would give us a stern talking to about brushing and flossing and keeping that pocket clean. They might even recommend some advanced procedures. It's just really hard for us to tell people to go home and floss their dog's teeth. So it kind of plays a role in what we would recommend for this stage.
What you can't appreciate there, though, is that there's still what looks like a normal amount of gingiva on the back of that tooth when you look at this photo, right, kind of where that A is. And so periodontal disease, I think this sort of highlights how it can be pretty insidious. And I think that people understanding when they first kind of start, they get an animal, a patient, a pet into their household. I think having them already have an understanding of what periodontal disease is, how insidious it can be, not only what they can be doing at home, but then why it's important for them to seek veterinary care, especially for certain breeds. So we'll kind of get into some prevention stuff here once we wrap this up with the stages.
This is stage 4, and you can kind of smell it before you see it. This is a very pretty heavily affected mouth. You can see between the red and yellow lines on the x-ray that we're talking about bone loss that is, greater than half the root surface. So these teeth are really trying to get out of the body. I think it's important for owners to also understand that once we get to a certain level, there's not a really be all end all great way to regrow bone in dogs and cats. We try to do some procedures, but it takes an owner that's super dedicated. It takes a dog or, whoever that is really tolerant of cleanings and other therapies. So we don't like to see this, but we see it a lot.
Yeah, so I think what's important, I hope, for y'all, and we'll probably spend kind of the rest of our time here talking about this, because I think there are some really good things that y'all can know, and you can be a part of this education process for these new puppy owners with preventing periodontal disease. And I think all of the prevention, the majority, is aimed at removing plaque from the tooth surface, which just means trying to keep the teeth clean. So normal periodontium, normal periodontal tissues, when we talk about the tooth and the bone and the gingiva, is really, under normal healthy circumstances, really designed pretty well. Mother Nature did a good job with that, and it works well under normal circumstances. But what happens is when plaque starts to accumulate on the tooth surface, which even when we go have our teeth cleaned, plaque accumulates within hours. Very quickly, it's starting to come back. We tell people it's what you feel on your teeth when you wake up in the morning before you brush your teeth. You brush your teeth and your teeth feel cleaner. You leave the dentist and your teeth have been cleaned, and you can feel that. But within hours, plaque is starting to accumulate. And so the best way to prevent periodontal disease is plaque prevention. And the best ways to do that is not a surprise. It's brushing. And we tell people that if they can brush their dog's teeth every day, twice a day is great, but every day, if they can do that, they're going to have and studies have shown this, they're going to have a significant impact on preventing plaque and calculus formation on the tooth, preventing periodontal disease, preventing gingivitis. Those scores are all going to be better if they're able to do this. And so we tell people any soft bristled toothbrush will work. There are dog toothbrushes out there. There's nothing magical about them. Any toothbrush that's an appropriate size will work. For a lot of small breed dogs, obviously they're the ones where we're a little more concerned about them developing periodontal disease. We know it's very, very likely that will happen. I tell people, get a kid's toothbrush. It's got a little short handle, a small head, and that may work a little bit better. I do think that it does matter that it's a tooth with real bristles. In our experience and the studies that are out there, using some of those finger brushes or the things that have kind of the soft, rubbery, kind of knobby type of bristles, not very effective at removing plaque. Wiping the teeth, sometimes people will ask about that with like a gauze sponge or something. Also not very effective. By far the most effective thing is a soft bristled toothbrush. We tell people that the minimum frequency really needs to be every other day. So if they can do it every day, that's fantastic. If they can do it twice a day, they're like a superstar. If they can at least do it every other day, they're still going to have a significant influence over preventing those early stages of periodontal disease, especially. The reason for that is when plaque sits on the tooth surface, after about 72 hours, it starts to mineralize and harden. And so plaque, you can feel it on your teeth, but you can't really see it. It's that little thin biofilm that forms on the tooth surface. And after about 72 hours, because of the minerals and the components in the saliva, it starts to harden and mineralize, and it turns into dental calculus or tartar. And that's what you can see on the tooth. That's what's shown there in the picture. It's that yellowish or brown colored material that's stuck to the tooth surface. And now you can't brush it off. What you can do is you can brush the surface of that, and it will help prevent plaque formation on that. But now, instead of having a nice smooth enamel surface like what you would normally have, again, the normal tissues are pretty good at helping to prevent periodontal disease if we can keep them like like Mother Nature intended. And so that enamel surface, when it's smooth and first cleaned, it's much easier to brush the plaque off. Once the calculus starts to form, it's a little bit harder, although it doesn't mean that they should stop. So that they'll not be able to remove. It'll have to be professionally cleaned some way or another. But it's also important to point out that that accumulation on the tooth surface that you can see really is not the problem. It's really not where periodontal disease starts. Periodontal disease is starting right there along the gum line. And so it's that plaque and subsequently calculus that forms just at or just underneath really that gingiva, kind of the part that you really can't see. That's where periodontal disease starts. And that has to do with the bacteria that's there, that's inside that plaque. And then the body's immune system is reacting to that plaque and that bacteria. That's what gingivitis is. And then it's the body's immune system response to that that causes destruction of the tissues that starts to lead to pocketing and attachment loss. And then it becomes this cycle. And once we start to lose that attachment, so once we get to that stage 2 of periodontal disease, where we're starting to have what are likely to be some permanent changes to the periodontal tissues, that's why we say that's irreversible, because now it's very difficult to restore what Mother Nature had kind of initially created. And so toothbrushing, for sure, the best thing. The next best thing is going to be dental chews, treats, and diets. And we kind of lump those in together because those are things that are also going to provide some mechanical cleaning of the teeth. We'll probably talk about this, and you would find these on this website. We'll talk about VOHC. Some of you may already be familiar with it. But after brushing, it's chews, treats, and diets. And then after that, we would say that some of those wipes, gels, rinses, and water additives are all kind of the least effective thing. They're not pointless. I do think that there's some benefit to doing that. And there are some studies that show that there may be for some products. But that's where we start to get into really needing some good evidence that they work. And that has kind of been the aim of the Veterinary Oral Health Council for a while. So if you're not familiar with this, it is basically a group of veterinary dentists. It's part of the American Veterinary Dental College, which is the specialty organization for dentistry. And they are kind of a third-party evaluator of the existing research that exists on a product. And so you get a group of experts in veterinary dentistry that will critically evaluate the information that exists on certain products. Companies have to volunteer to seek VOHC approval, and they do that. Their products are evaluated, and if the product is deemed to be safe and effective at what it claims to do, then it may receive the VOHC seal. And so on that website, you will find, you have another slide for that? You can go to vohc.org. You can also probably get there through the AVDC's website. And on the VOHC site, you would find a page for VOHC accepted products. They're sorted by dogs and cats, and then they're sorted by product type. And so it'll tell you what the product type is, and then it'll also tell you what the claim is for. And so if it says that it will help prevent plaque and tartar or calculus, then it's been determined that it is effective at doing that. But in general, in order of effectiveness, we go brushing, chews, treats, diets, and then lastly, those other products, wipes, gels, rinses, and water additives. So if somebody says, I can't do anything, but I can put something in the water, then if it's listed on the VOHC website, I would say that a group of experts has decided that to the extent that water additives can be helpful, this is one that would be recommended. So there's information there. I think it's a valuable resource for you all to be able to provide to owners. Very often when we provide this information, it's the first time that they heard it. And so I really think that you guys have an opportunity to help people by steering them towards approved products. I mean, we don't benefit in any kind of way from from people going to this website. It's just it's a way to kind of give them reliable information. When we talk about chews, treats, and diets, the reason why those work is because of that mechanical chewing action that the dogs are able to do. And so I just always want to remind people that when I'm talking to them, that these products are only going to help with the teeth that they chew with. So sometimes we see dogs that have like a fractured canine tooth or a fractured incisor, and people may mention that they think it might be because of something hard that they've been chewing. And very often I think that probably isn't the case. These things that they chew, if they're inappropriate, are more likely to break the teeth that they chew with, which is the ones in the back of the mouth. And I think we'll show you a picture in a minute. So if someone says, well, I kind of have a hard time brushing, especially those teeth in the back of the mouth, then I think you start to look at options for combining preventatives. And what does work well for a lot of people, they have an easier time brushing the teeth in the front. They may be able to brush those canines and incisors because they're easy to get to. They just lift the lip and they can get to that. Whereas those teeth in the back of the mouth, the dog may be a little bit more resistant to having somebody get back there. But if they are inclined to want to chew, you may be able to find an acceptable chew for them. And so then we can kind of hopefully effectively address all of the teeth in the mouth. So I think we'll kind of mention good and bad things about chews and treats, kind of what to look for, what to avoid.
Yeah, I included pictures of these two things because I think it's probably pretty common that we see these two types of treats that bring patients into our office. The one on the right is yak milk or yak cheese or something or other, but it's a very hard, very plasticky, dense material. And then we have antlers on the left, also super hard, you know, a little bit too hard, because then people come see us and they say, oh, my dog has this broken tooth. So you can see that fracture on the upper left. That's the fourth premolar. That's the big chewing tooth. You can see how it sits and uses the lower big carnasial tooth, that big molar, and that's where the main part of chewing is done on those types of products. So we don't like to really recommend anything that's that hard, and really do recommend trying to choose a chew that you can bend. So in the picture on the bottom, I'm holding a chew and I'm showing that it is bendable and it's flexible. Also, I think that imprinting with your fingernail, any chew or any hard rubber that you can imprint a little bit, it's not as hard as maybe that yak chew or an antler. It's a little bit softer. We, you know, have to still be really careful about what we give our pets. We don't want to throw them something that they could ingest and vomit up later and walk out the door and go to work for 8 hours. I always, you know, kind of caution people about giving chews and things, and just knowing that, you know, they could ingest a large part of it, and we want to kind of monitor them while they're chewing.
Yeah, I tell people all the time, Dr. Duke has heard me say this, that, you know, people chip their teeth all the time, eating hard candies and ice cubes, Jolly Ranchers, you know, like that kind of thing. We all understand that there are things that if we bite down on it, it's pretty hard and we could chip a tooth. And I think you may have experienced that yourself, or you certainly may know somebody, but it's not hard to imagine. And so dogs, their enamel in their teeth, and for what it's worth, enamel is the hardest, most dense material in the body, more dense than bone. And that's that kind of thin covering on the tooth that helps protect the tooth. Well, a dog's enamel is actually thinner than our enamel on our teeth. And so dog teeth probably are actually somewhat more susceptible to breaking than ours are. And so we just say, if you look at something and you think, well, that's really hard, if I bit down on that, I could chip a tooth, then the dog could as well. So that's why having a little bit of flex, a little bit of give, you can make a little mark in it. Then when they bite down on it, it's not quite so rigid. It's got a little bit of give to it. And that probably is something that's acceptable.
I think we kind of already touched on this, but I call it the multimodal approach to oral home care. Be realistic that I can't even get my kids to brush their teeth every single day. It's hard sometimes. So I think doing kind of this like spread out approach, like you were talking about earlier, where maybe you feed a dental diet, plus you do chews every other day and then you brush the other days. I think that something like that really does help. Or again, like you were saying, like we're talking about, you can brush in the front of the mouth maybe, but in the back of the mouth, it's a little more difficult. So that's just all this is really showing in a couple of products on the right. I think it might be a great idea, for dog breeders and to kind of come up with a new puppy kit type of deal where maybe you have some information on the VOHC that you provide to new owners and maybe some samples of things or, toothbrushes. It's really up to you how far you guys want to take this information, but I do think it would just be a nice like take home that comes alongside their vaccine records or what have you. And then I did just kind of want to touch on the American Animal Hospital Association has made some recommendation. These are from 2019. I don't think they've been updated since then, but
And they're still pretty relevant and accurate,
they are,
though. I
yeah.
would say not much of this has changed.
Yeah. So I think we're really just wanting to define that a true dental prophylaxis, meaning cleaning the teeth, polishing, doing intraoral radiographs, is recommended by 1 year of age for cats and small breed to medium breed dogs. So we're talking about your toy poodles and, maybe smaller breed dogs that have crowded teeth like our Shih Tzus, and then 2 years of age for larger breed dogs. Just something to consider. And is also recommending, especially if you're breeding dogs in those higher risk categories, just kind of starting that and spreading that information sooner to new puppy owners.
Yeah, I don't know if there's any greyhound breeders in the audience, but probably not. But if there is, we kind of lump them in with the small breed dogs on the risk of periodontal disease. That would be kind of the one sort of larger breed exception to that, I would think, just because it's so common.
Yeah.
So I think we've got, we've got time. So we've got a few minutes for questions. I think Dr. Ritter had a couple that were submitted ahead of time, and maybe one of those we addressed, but I don't know, Dr. Ritter, if you want to.
Yeah, absolutely. You did address them, but we can repeat regardless. I know a couple of the products you mentioned were on that website, but someone wrote in, they live in an area where fluoride is no longer being added to the water. Does this impact my dog's teeth? And if so, what recommendations do you have for products? So I know you had the recommended part covered, but I was wondering if you have any comments on that.
Yeah, so I think that we live in Florida, and so we're in a state that that is now the case, from what I understand. And to be honest, I don't necessarily follow that to know exactly when that went into effect. Maybe it's happened
in the past month. I think it's happened.
Okay,
happening.
so fluoride when ingested, this is true for us and for dogs. It can cause GI upset. It can make you sick. Now, the reason why fluoride has been a part of dental products for us is because of a propensity for us to develop cavities. And that is something that does help with the hardness of the enamel and reinforcing that, and does help prevent some of the destructive processes that can happen to the dental hard tissues. So when we talk about cavities, the reason why a cavity forms is because the type of bacteria that sits on the tooth surface in that plaque that we were talking about earlier, when it consumes carbohydrates, it will produce a byproduct, an acid that will degrade and erode the dental hard tissue, specifically that hard outer covering, the enamel. And so that's how a cavity forms on our teeth. Now, cavities are pretty rare actually in dogs. And so I guess time will tell, and maybe we'll say something different. I don't know if we really know how it's going to impact dogs for the fluoride to be removed from the water. I suspect it will be very little because cavities are such a rare problem that we see. Now, there are products that some veterinarians will carry and will apply at the time of a cleaning. There are fluoride foam products that can be applied after a cleaning. I think that that may help, but I think that in general, it's pretty difficult to put fluoride in products that your average pet owner is going to be using every day, because when they go to brush the teeth, they can't really prevent that dog from ingesting that. And I think the risk of it causing GI upset probably greater than the risk that not having it is going to lead to cavities. I just think we don't see cavities enough to really worry about that. So I'm hoping that this doesn't end up affecting our dog population to any significant degree.
Awesome. Thank you. Really interesting. We had another question. I know you talked about the recommended items list. A couple of people have asked that their dogs like to chew on kind of natural items, if you will, whether it be pine cones or bones or what have you. Is that a safe option if they find them on their own, or would you still recommend sticking to the list that you referred to previously?
Well, I think the list in the website is there's evidence to support that. That's obviously a safe place to stick. And if it's possible to find something from the list that is acceptable for a given dog, then I would say that would be the best thing to do. But I think what's more important is to stick with some of the like broad criteria for the nature of an individual item, meaning that something that's very rigid, very hard, very inflexible is very likely to break a tooth. That broken upper fourth premolar that we showed a picture of is the most common tooth that we see broken, and it's always from chewing something hard. And so if a dog chews a pine cone, to me, a pine cone can very easily be flexed or bent. I mean, I can go and kind of like pick the pieces of it off. That center part is like a little crunch to it, but can kind of probably be broken up. It's got a little give, is my point. A stick that's been sitting on the ground for, an extended period of time, probably already starting to soften up a little bit. But real bones are one of the most common things that we see dogs break their teeth on. And I think in general, real bones should be avoided.
Great, thank you. Maybe time for one more, if you both don't mind. We often get questions on our thoughts on anesthesia-free dental procedures. I was wondering if you could speak to that.
Yeah, so I think that the AVDC has a position statement on this, which you can read if you go to the AVDC's website. But I think for what we think about it is the anesthesia-free cleaning. I think that there's kind of two things to consider about this. One is just the anesthesia, and the second is the cleaning part that happens at the anesthesia-free cleaning. And so we should probably talk about those separately. The anesthesia part is, I believe, that the approach and the appeal really of the anesthesia-free cleaning is because there is a general concern, and in some cases it becomes fear of putting dogs under general anesthesia. And there's been some pretty big studies that have looked at kind of the true risk of general anesthesia for dogs. And the risk of anesthetic-related death, which would obviously be the worst possible outcome, is actually quite low. It's like 0.1%. So in general anesthesia is pretty safe for most dogs. Now, there are times when that risk increases, and it may increase significantly. And if it does, it may, in some cases, mean that patient cannot go under general anesthesia because the risk would be too great. I do also recognize that many of us either have firsthand experience or secondhand experience of an animal, a dog, having a bad outcome with anesthesia. And so it's that awareness that problems can happen, because we can't make the risk zero. That is a reason why people will elect to pursue the anesthesia-free cleaning. But we do anesthesia on all of our patients in our practice. We do a lot of high-risk anesthesia in our practice. It's very rare that we have a patient that we can't put under anesthesia. I believe that there is a safe way to do general anesthesia for most dogs. And we have a board certified anesthesiologist in our practice for those patients that are at high risk. And on rare occasions, we've looked at a patient and gone, we shouldn't do this. This is not a good idea. But for the most part, it can be done. I just think that those families and veterinarians, everyone has to kind of work together to make sure that everything's in place to make it safe. So that's the anesthesia part. I think the fear of anesthesia shouldn't maybe be quite as great as it is. But the second part is the cleaning part. And this is where I probably differ a little bit from some of my colleagues. I actually think that anesthesia, I should be careful in saying this, but I think that anesthesia-free cleanings can have a place in the kind of overall home care and periodontal disease prevention plan for a given individual dog. But what shouldn't happen, and what often does happen, that I think is a mistake, is when the anesthesia-free cleaning is considered to be an acceptable or appropriate substitute for the anesthetized cleaning. And the reason is because of what we already said. We said this earlier, we started talking about periodontal disease. It starts right below the gum line. And that's a spot that if we don't get that part clean, we're going to continue to have periodontal disease. So what you'll see before and after pictures after an anesthesia-free cleaning, the teeth will look beautiful. That part of the tooth that you can see gets cleaned up if they're able to do a good job, and a lot of times they are. So there's this kind of this like sense, this sort of false security that we've done a good job and we've cleaned the teeth. And oftentimes what fails to happen, and it's just a product of just a limitation of the anesthesia-free cleaning, is there's a little bit of an inability to clean thoroughly that area right below the gum line. And so if we have stage 1 periodontal disease and we can prevent it, if we don't clean right below the gum line, it's going to progress to stage 2 and on and on, whether we clean the crown of the tooth or not. And so if we don't do that, it's going to progress. If we do that, we're going to revert back to stage 0 and a healthy mouth, and then we'll kind of keep trying to manage it in that space. And so there's a decreased ability for that to be thorough. There's also, I think, a decreased ability for the operator, whoever's performing the procedure, to be able to do quite as thorough an oral exam. So when we have a patient that comes to us for what is expected to be a routine cleaning, to us, the cleaning part is only part of it. This is like a diagnostic procedure where if there's a problem in the mouth, we want to find it. And like we showed in the stage 3 periodontal disease picture, it's why I brought it up. It can be insidious. That gingiva can look very good, and you can go and clean that area and think you've done a good job. And if you don't put a probe in it and you don't do imaging, you would miss that deep periodontal pocket that was on the back of that lower molar that we showed you. And so we have seen patients that have gone for anesthesia-free cleaning one after another over time. And then when we see them in our practice and we do an oral exam and we probe and we take dental x-rays, we find problems that have probably been there for quite a while. They've been overlooked. And again, it's not necessarily the fault of the operator. It's just a limitation of what they're able to do. And in order to do imaging, they have to be under anesthesia. So the probe and the imaging are kind of like the two key components to finding a problem that exists in the mouth. And if we can't do a good enough job with the probing and we can't do the imaging at all, then the anesthesia-free procedure is going to miss existing disease in many, many cases. So here's where I think I differ. I actually think that for people that were wanting to do everything that they can do, if we accept that it's not an okay alternative and a substitute for going under anesthesia, and we recognize that anesthesia is safe, we can provide an anesthetized professional cleaning with imaging, probing, and find and treat any problems that we have. If owners are then interested in doing home care, whether that's brushing, chews, treats, diets, but they're like, what else can we do? Then I actually think that an anesthesia-free cleaning that gets performed sometime in between that anesthetized procedure and the next anesthetized procedure may allow us to prolong the time between anesthetized procedures. So maybe instead of that Chihuahua going every year for an anesthetized cleaning, maybe now it goes every 18 months. And it gets 1 or 2 anesthesia-free cleanings in the meantime to kind of help keep the accumulation off the tooth. So that's a very, very long-winded answer, but I feel like it's a really good question. It's one we get a lot. And I think that that's how I want people to understand the anesthesia-free cleaning. I'm not the person who's going to bash it, kind of, throwing baby out with the bathwater. But I do think that there's needs to be an understanding about what its limitations are and when it is and isn't appropriate.
I think a really fantastic answer. Thank you both so much. That was a great presentation and great Q&A. Nicole, I will turn it over to you.
Yeah, thank you both so much. This was so interesting. I think our community agrees just based on everyone's response in the chat so far. So we cannot thank you again enough for doing this for us. Thank you all so much for joining us, to all of our breeders out there. If you're not yet part of our community, you can always apply to join at gooddog.com/join. We just dropped that in the chat one more time so everyone has that. And I just want to leave everyone with a sneak peek of our next webinar, because we're always looking ahead here at Good Dog. And that will be on Wednesday, August 27th at 1 p.m. Eastern, right back here on Zoom. And it's going to be Managing the Oops Pregnancy with Dr. Andrea Hesser, who I know we've been lucky enough to have on many times this year already. I know everyone loves her, so we are so excited to have her back. And again, that's on August 27th, so a little bit of time until our next one, but we will be sending out invitations, emails, all of that good stuff so everyone stays updated. But until then, I hope everyone has a wonderful week. Thank you both again, and we will see you all at our next webinar. Bye, everyone. Thank you.
Yep.